Welcome. My name's Tim Markle. I'm director of the Wisconsin Youth Health Transition Initiative. This series is all about healthcare transition and the Wisconsin school nurses. Thank you for the vital role you play in the lives of our students. Whether they're in special education or they have a 504, you are that connection between the education world and the healthcare world. And our families and our students need you. One of the areas that we really need you in is in this area of healthcare transition. So the Youth Health Transition Initiative in Wisconsin, we work with healthcare systems to help them design and implement transition process to help their patients move from the adolescent or child world of healthcare into the adult world of healthcare. We work with families and self-advocates to increase their health and their knowledge about healthcare so that they can transition into adulthood. We work with our education partners to integrate healthcare transition into the world of transition. We work with our job and employment partners to help understand what is the role that health and healthcare can play in successful employment. And we work with a number of partners then in helping our young adults to transition into the community world. We go to resource fairs, we offer trainings, we try to find partners and support them where they're at, bringing our knowledge of healthcare transition. So let's talk a little bit about what is healthcare transition. When we talk healthcare transition, we are referring to the process of moving from that child or adolescent care setting into the adult care setting, into the world or the system of adult healthcare. Now, there's differences between the adolescent care and adult care, even if a child isn't moving providers. Let's say they already have a family provider, not a pediatrician. There's still changes in the setting, in the way and the expectations of healthcare. And we'll talk about that at a later, we'll talk about some of those differences at a later video. But there's also a huge change if you're used to seeing a pediatrician or pediatric specialists. Those primary care and those specialists may change when you move into the adult world. So this is the way that I like to describe the process of healthcare transition. Number one is you have this time of preparation. From birth through adulthood, we are preparing our students, preparing our children to become adults. And so this is where they're learning about what is my attitude of self-advocacy, of taking charge of my own healthcare. They're building skills, they're building their knowledge. And so this is a time as we hit high school that is a great opportunity for all of our students to learn more and to practice these skills, possibly even by having a goal in their IEP or part of their post-secondary transition plan can be about healthcare. Then we have a point in healthcare called transition, transference, the transfer. This is when the care actually transfers from the pediatric or the adolescent world into adult healthcare. It may be a new provider, it may be a new clinic, but it's a new style of healthcare, and there's an actual transfer of care that goes on. And then we have the rest of their life. We have, this is the time spent in the adult healthcare world, where the doctors are looking not so much at developmentally what's going on, but with aging and continuing and maintaining health. They're going to be in that adult healthcare world for a lot longer than they're preparing, we hope, preparing to be in the adult healthcare world. And so we have this short period of time to help them prepare for this transfer of care, but then to succeed in the world of adult healthcare. This is where school nurses can help in this time of preparation so that they can graduate their students better able to succeed in the world of adult healthcare. So what are some areas that school nurses can work on? Well, I like to use the acronym ASK. So ASK. So number one, help our students build an attitude of self-advocacy and self-determination. That to the extent possible, that they are becoming the decision makers of their healthcare in the adult world. That's the general anticipation in the adult healthcare world, is that the patient is the decision maker. Is we know that families have grown up going to the doctor where the doctor is talking to the parent about the child that's right there in the room with them. We want to make sure and help that child to prepare to be that decision maker in their healthcare. Part of that is maybe encouraging them to spend time alone with their doctor, encouraging them to practice talking healthcare with you, their school nurse. Practice just asking questions about their healthcare, asking questions about their body, getting used to being the person that is most concerned about the health of their body. So you can help them by building that attitude, the attitude of self-determination, the attitude of asking for help and support. And then S, skills. There are skills that can be built during this transition process. Skills such as, how do I make an appointment? What do I do when the doctor's office is closed and I need to talk to a medical professional? That skill of reaching out for help, possibly the skill of putting the emergency contact numbers into their phone, the skill of filling prescriptions, of understanding what my medication is for, what it's supposed to do, and what it's not supposed to do. And then we have the K, the knowledge, building the knowledge. How do I interact with the healthcare system? What is my role? What is my role of insurance? What is a copay? The knowledge around how do I find an adult provider if all I've had is pediatric providers? And so that knowledge of the system as a whole, and the knowledge of how do I take care of myself? Individuals are individuals. Our bodies react differently depending on who we are. And so healthcare has to be very individualized as well. And when we have students with disabilities, even more so, is their bodies are reacting in very individualistic ways to what's going on around them. So in the area of healthcare transition, we ask that the school nurses are there to help our students understand that they are right now preparing and learning. They're learning how to build an attitude, they're learning how to build skills, they're building knowledge so that they will be successful in the adult world of healthcare. Thank you for your help. Again, we have a page devoted to school nurses and providing resources for school nurses in conjunction with Department of Public Instruction. And so you can find that at healthtransitionwi.org. There's also a place on that page where you can feel free to email us and let us know what other topics you think should be covered in healthcare transition and Wisconsin school nurses. Thank you for all you do.